Good morning, everybody, and welcome to all of you, whether you just came from the Friday huddle or whether you are brand new and just coming in right at 9 o'clock this morning. Thank you, everybody, for joining us today. My name is Jana Benton. I'm with the Oregon Center for Nursing, and I'm really excited to be able to share with you today some of the information that we have gathered over the past 4 years around the nursing workforce and the and well-being of the nursing workforce. Today, we're going to be taking a closer look at the initiative that we have put together specifically to address the mental and emotional well-being of nurses in the workplace, but looking at it through the lens of occupational wellness as opposed to individual self-treatment and some of the traditional wellness approaches. So today, the best people to tell the story about what we have been working on are the two people on our team who have immersed themselves into this work over the past few years, and that would be our program director, Don Schoenthal, and also our research director, Rick Allgaier. And honestly, I just want to jump into it both with the both of you to talk a little bit about what this program is, why we came up with this in the first place, and move into some of the things that we learned. So let's just start at the beginning. The RN Wellbeing Project, the RN Wellbeing Project, when we put it all together, what problem did we set out to solve? And I'm going to turn this over. Actually, before we get started a little bit, I kind of want to turn it to Dawn to just explain a little bit about the project in general. And then we will get to, and then I'd like Rick, if you wouldn't mind talking a little bit about some of the things that you've learned, and then we can ask the questions. So Dawn, can you talk a little bit about the project in general?
Yeah, so the Arm Wellbeing Project started back in 2022, and it was in direct response to the Friday Huddle group. And I'll let Rick talk a little bit more about the early beginnings of it because I came in a little bit later into the scope of the project. But it started in 2022 where we were looking at specific stressors, and it has carried through the last few years where we were doing pilot projects. We funded 18 different projects throughout the state based on that early intervention and research results. And they finished this year. So that's why we're having this conversation today is to talk about that, talk about how it went and where we're going to go next. But let's back it up. And Rick, can you give the introduction of
Sure,
how
sure.
it started?
So while the project officially started in 2022, we started thinking about this in 2020. If y'all remember what happened in March of 2020, that really shaped a lot of this. We started the Friday Huddle about that time, and we're hearing concerns from nurse leaders across the state on a host of topics. At the time, it was PPE, scarcity of PPE. It was facilities closing down. It was people being transferred around to departments they were unfamiliar with, or just having their facility closed down. A lot of ambulatory care centers closed for a while during that period. And so we were looking at things then. Which prompted us to write a series of explainers, just trying to understand and put together in context what folks were concerned about. And as the pandemic progressed, and even post-pandemic, one of the things that held was the well-being and mental health of the healthcare workers. It showed up in our first paper, and it was the only one of the few topics that was able to that we discussed that continued to be an issue that we were discussing.
Mhm.
And so all of this came out of that work as we were looking at publication, at the literature. We were looking at organizations who were surveying healthcare workers across the country. So that's kind of where all this started. And then we were able to formalize it into the Wellbeing Project that started in 2022.
Very good. So, Rick, can you tell us a little bit about what was the problem that we were trying to solve that existing wellness programs weren't able to solve?
Sure, sure. So if you so there's a couple issues we're going to run into. We're going to keep seeing these kinds of issues. One is we didn't have a whole lot of information and data on the well-being of the workforce prior to the pandemic. So we heard anecdotal stories that folks are stressed and burnout and all that stuff. But we didn't have a lot of hard data to support it. But one of the things we started seeing was um, during the pandemic and as it was progressing, we started seeing a lot more data on the mental health, mental well-being of the healthcare workers across the country and across the world, to be honest. And one of the things that we were doing was we were seeing information. McKinsey put out a really good report in April of 2021. The American Organization of Nurse Leaders put out a survey, and NLN put out a survey where they were looking at nurse leaders being very concerned about the well-being of their workforce. And they were talking about the things that they were doing to support their workforce. What we found was what was really interesting, what kind of sparked a lot of our thinking was there was a huge disconnect between what management were doing and what the workers actually want, what nursing staff actually wanted. So, so we were finding that nurse leaders said, "Oh, we were doing this, this, and this," and the workers going, "Yeah, that's really nice, but not helpful. Talk to us." But then they weren't talking to the nurses. They were just doing things because that's what we'd always done before. We'd always relied most heavily on personal responsibility to become resilient on your own, to deal with things on your own. And the workforce was, we provided some things, but they were more perks than integrated in part of the workforce. And so that's what we were really trying to solve is we were trying to solve that disconnect between what the employers were doing or saying they were doing and what the employees actually needed.
Very good. Thank you. I noticed that Don put in the chat some of the publications that Rick was referring to when he was just speaking now. So feel free to go ahead and click on those if you'd like to. And also, if you have any questions as we go along, we're going to have a section for Q&A at the very end of at the end of the panel discussion. If you have any questions, go ahead and put those also into the chat so that we can make sure that we address those questions. The next question I have is for Dawn. As we were starting to see this disconnect that was happening, you were looking at, some of the systemic things. And why do you believe that the solution that we were looking at, why did you believe that we needed to move that beyond that self-responsibility, that self-care, and talking individually to people and move it towards more of a systemic solution?
Oh my gosh, so many factors, right? I worked in a healthcare system, so I saw firsthand the results of doing things for people and not with people, and the impact and the stress that actually agitated. And when the pandemic started, self-care was the buzzword, right? Everybody was doing self-care. Not that there isn't an importance there is, but when you're talking about actual stressors, the data was real, and the research was available to us, and it actually goes way back, even to 2012. We stopped looking further back than that when we were doing the research, but just as Rick had pointed out, there's a disconnect between what employers were doing, and they were doing a lot. There's no question whatsoever that employers tried so hard to do things for their staff.
Yeah.
It just wasn't what their staff recognized as what they needed. And so that was the gap we were trying to fill. And you can't fill that by sending someone home to have a tea or a bubble bath or a massage. That's only going to make them feel temporarily better. It's not changing the situation they're returning back to. So the environment itself is what we were really looking to aid and assist with all the stressors. Because as Rick mentioned, the pandemic didn't create stress. It existed, it pre-existed. It may have exacerbated it, but it certainly pre-existed. And those were the environmental factors that we felt very strongly that we had to address. And self-care has a place, just not where we were headed for systemic factors. And I'm thrilled, actually, at the time we were saying it and doing it, the volunteer group we put together was immeasurable in creating and identifying what we needed to look at. But the vast majority of the narrative across the nation was stuck on self-care and resilience training. And I can say very proudly and excitedly today that narrative has changed, and it's in alignment with what we have been saying since 2020 actually, but 2022 is when the project began.
Right.
Yeah, thank you.
And just to add on to that is one of the things we also saw around the same time was a social change within the workforce.
Mhm.
There are a couple of economists that were dealing with a theory on turnover. Then they call it the embeddedness theory. And what they basically does is says it's not just work, satisfaction, and pay that keeps you in your position. It's a whole host of other things, like how well you fit into that organization, how strong are your connections with your coworkers, and what kind of sacrifice do you have if you leave that organization. And one of the things that these guys did around the same time was argue that COVID pandemic served as a shock to this system that caused a lot of people to rethink things. And so now today, when we're talking about, even during the Friday huddle this morning, we were talking about students are out evaluating their potential workplaces.
Yeah.
That is a direct impact of this change in this cultural shift that happened during the pandemic, where the culture of an organization is so important. And so, in order to get away from the self-care and start looking more systemically, you need to look at changes within the organization that the organization can actually make to benefit the mental health and well-being of their workforce.
Very good. Yeah, I remember in the course of doing this project from the very beginning, the language and the terminology about what we were talking about started to shift. Like,
Mhm.
now at the beginning we were talking about resilience and we were talking about burnout, and then very, very quickly it felt like within like a year or two, the words resilience and burnout almost became bad words and things you didn't want to say in healthcare settings, and you didn't want to call nurses
Mhm.
heroes because they weren't that it was being overused and it was kind of directing people to a problem that we were also identifying wasn't even real.
Well,
So
yeah, it was harmful, right? The
yeah,
language that was being used was actually harmful, and it's because it
Right.
was misplacing the the identification of the problem. And if you
right.
can't identify the problem correctly, then whatever solutions you're producing are likely to be off base and off target, and you're just then going to perpetually create more stress. So,
Mhm.
yeah, it was and
Yeah.
continues to be harmful if used inappropriately.
Right. It was also a focal point of the responsibility. Was it the employee's responsibility solely, or did the employers try to take some role in ameliorating some of these issues?
Exactly. So one of the first things that we did when we identified all of
Mhm.
these issues and we pulled all this data together, Rick put together his briefs. One of the first things that we really wanted to understand is what was the state of nurses in the state. So in 2022, we did a statewide survey. Rick, can you talk a little bit
Sure.
about that survey? Like, what did we learn?
Sure.
Mostly, what stood out to you about that survey at that time?
Sure. So in reality, we did this survey because we didn't have any good hard information about what was going on in Oregon. We do know that states differ dramatically across on a lot of different dimensions. And we were curious to see how it changed here, but we didn't have really any really good data on it. And most of the data we were seeing nationwide was so aggregate.
Did Rick cut out for anybody else or just me?
Yeah, I cut out too. I thought it was me.
No, you're
No, your audio split.
Okay. And
there
There
you
you
are.
go. There you are.
I have no idea why. It just says my
Total mass
internet's
projections.
unstable.
We've been talking about this. Yeah, the sunset.
Okay. So I kind of lost my train of thought, but whatever. So anyway, since we didn't really have very good information what was going on in Oregon, we decided to ask. And so we worked with the OSBN to survey basically every registered nurse in the state. We got 5,000, a little more than 5,000 responses back. And what really shook me was how stressed people were. Um, the numbers were off the wall. 80% of nurses said they reported stress. People were having trouble sleeping. They lost appetite. They had a whole host of issues that they were facing. And one of the things that was really shocking to us is they were receiving very little support at work. Outside of their coworkers, nurses reported at the time, that was about it. If it wasn't a coworker, they really weren't getting support. They were mainly relying on support from the house, from home.
Mhm. So when we started to see how widespread all that stress was and the
Mhm.
challenges that our nursing workforce was facing, the next question that we were faced with was, well, what are we supposed to do about it? Especially when we have like, this is very widespread. And again, like Rick said, we didn't have pre-data to know exactly where it was, but we do know that healthcare is a stressful environment. So Dawn, that kind of went over to you and your group of volunteers that you were working with, because you did an exhaustive literature review. You had a lot of conversations with that volunteer group, and we kind of narrowed it down into kind of like bunched it into two groups. Can you explain those two groups a little bit of the different kind of stressors that we were noticing that are unique to nurses and unique to healthcare settings?
Yeah, so the volunteer group we put together had an initial task of really looking at the systemic drivers of burnout. That was the start of the project phase. And we looked over, honestly, about 126 different pieces of literature that were rooted in systemic drivers of burnout. And through that process, we were able to identify these different domains, but also in an unexpected turn, we also recognized that there were other contributing factors that were harmful within the spectrum of work and practice settings of caregivers that weren't exactly systemic drivers that could be removed or changed, but they exist and they must be managed. And that's really where the resilience piece comes in. So we kind of held off on that discovery because we really wanted to pilot off some projects and get some things started and make some meaningful change as soon as possible based on that initial driver of identifying systemic causes to burnout. And in that, we ended up calling them two different constructs. So we have removable stressors, and those are the systemic drivers of burnout that we can immediately address and make better in a workplace environment. And then we also have what we discovered were manageable stressors. So things that are going to exist that need to have support within the system itself so that every human being doing the work can continue to do the work as their whole human selves. So starting first with the removable stressors, there were really 4 different domains that we captured within that scope of work. And it was to help identify what projects could be implemented right away and help to just convey the information. 126 pieces of literature is really a lot of work, and nobody's really going to go through that unless that's what you're tasked to do. So how do we convey this information to employers and other people listening? And so that's where the 4 domains came out of, is that we identified capturing these segments of pieces that fits together in different domains so that if an organization wanted to do something, they could look at a particular domain that they might identify as a struggle and know where to begin. And so the 4 domains that were work system and labor model redesign, that's really about how your work schedules and workloads and just your whole process of engagement or of operation evolves around the employer and the employee relationship. Then there's the workplace well-being and safety infrastructure. This is the physical environment within the work itself. So where workplaces are able to offer hydration stations and meaningful, nutritious meals and time off away for breaks and the silent spaces, as well as how are you responding to violence within the workplace and policies that kind of integrate into that psychological safety domain that's there too. The 3rd domain was healthy leadership, driving healthy culture. So where do leaders fit in? And leaders, we recognize at the time and still to today, they have their own well-being to be concerned about too, right? If you have well-being, a leader that is lacking in well-being, your teams are likely going to lack in well-being too. So we recognize healthy leadership is very important and put together the factors within that impact leaders themselves and then fold out into teams. And the final domain is administrative processes and professional practice. And this really goes down to overall how work is getting done administratively. So this is more like your EMRs and your policies and procedures, things that are by domain and administrative tasks that can be altered. So those are the 4 removable stressors that we began with, which primarily were drivers for the pilot projects that we did over the last few years.
Very good. Thank you. Let me tell you guys a little bit about what happened with that, because I mean, all of this 126 pieces of literature that are looked at And all of the papers and the things that Rick did really kind of led us to the point where, we understand what the insight is, but we needed to do something. So OCN was able to work with Senator Jeff Merkley's office and Senator Ron Wyden's office to receive a federal grant through SAMHSA that would fund a certain portion of the projects, but we were also able to work with the Oregon Department of Human Services to fund some projects that were really specific to long-term care settings. And through those, we were able to put together 18 different projects and those projects were basically looking at all of the insight and all of the data that we have put together. What are some of the things that we know about these removable stressors? What are some things that these organizations could do to remove some of these stressors, and would that impact well-being? And so that is what we've been doing. That's what this whole project has been. Some of the projects that we had, they modernized their EHR systems. Some renovated some rest spaces for their nurses, or they had some peer support models that they did. Some focused on leadership training to build some of their psychologically safe cultures. Everybody tried a little bit of something different, and I was personally excited to be able to actually be able to try out all of these different innovations, knowing that some of them would knock it out of the ballpark and some of them would sputter along, but not aimlessly. Like even the sputtering, there's learning to be done from that. Even if it doesn't go exactly as it's planned, there is so much learning that can be done from that. So we were really excited. And that's, again, part of the reason why we're here. Those projects are all done. We've now completed all of the projects. They've gone through all of their process. We are putting together a portfolio of all of the different projects so you can see all of them. And it will also have the story that we're telling you here today about how this all came about. That's going to be released pretty soon, before the Thanksgiving holiday. I think you can expect to see that. We're not going to go into every single project that we went to today, because that's not a good use of today's time. What we really want to use our time today is to discuss the outcome of the entire project, and things that you might be able to take away from what we have learned over the many years that we've been working on this, from the projects that have been going on for the 2 years, and from all the research that happened for the 2 years before that. I really want to make sure that we can give some time to take away from all of those things. We do have really good data, because I don't know if you know this about us. We really enjoy us some good evidence here, and we're a little bit of data nerds. So one of the things that we did is, in addition to the survey that we conducted in 2022, we also we did pre and post surveys for all of the participants that we could get to within each of those projects. And then we repeated that survey. So Rick, let's talk about the repeat of the survey, because we just repeated that survey this last summer. What did you observe?
So as Jen alluded, we redid basically the same survey we did in 2022. We made some changes to it based on things we learned from 2022. But basically what we found is, while stress levels, anxiety, a lot of the different things that we were seeing in 2022, while those levels declined some, they're still really high, which was really, really surprising to us that it was so high. The issue we ran into is we don't have a baseline. We don't know what they were prior to the pandemic. So we don't know if we're looking at a reversion back to baseline, or are we just still looking at elevated stress due to a host of the things that are going on in the world right now post-pandemic. So that's an interesting question. We're kind of treating it as we're going back to some kind of elevated baseline. But we also found that the decline in certain stressors was kind of dependent on where you worked. Ambulatory care centers, the ambulatory care in general saw a much bigger decline and much lower levels of stress, anxiety, overwhelm than did hospitals and long-term care. Hospitals tended to come down declined a little further than did long-term care. But we did see this dichotomy between different kinds of practice settings. as Janice said, we do have a lot of data. And so what we're looking at is we're looking at some of those things in depth to try to understand a little bit more.
We did take a lot of feedback from the 2022 survey and from people that took the survey in the beginning. In the 2022 survey, we took a little bit of feedback from them. And one of the things that I thought was really interesting is when we asked the question of where you're getting your support in the 2022 survey, we did not ask the question, are you getting support from pets? And so we did ask that in the 2025 survey. And just so you know, a lot of people get some support from pets, but we don't have a baseline. It was more of like this,
Right.
when we have a chance to do this survey again in the next few years, we will be able to compare pets from 2025 onward. But it's very interesting the number
It
of
was
people.
interesting. About half
Mhm.
were claimed they were getting support from their pets.
Yeah, I think that
Yeah.
that's not, I mean, that makes, to me, that makes a lot of sense. And also at the Magnet and Pathways Conference in Atlanta this year, they had a puppy petting station. And now I see that there might be some evidence base for that. So Rick, let's go back to the survey.
Mhm.
In addition to the survey that we did between the 2022 and the 2025 statewide of
Mhm.
nurses, we also did those pre and post tests of those individual projects where we were trying to actually make an intervention. What were the results of that, of those projects compared to the statewide average?
Well, the basically what we found was that the organizations that participated in one of these projects saw their stress levels decline much greater than what we saw between the 22 and 25 surveys, which means that, so if you think about any kind of event, that there's lingering effects of it, and those effects dissipate with time. And so one of the things that we were thinking about by 2025, we've been basically 3 years past the pandemic when they declared it not an emergency anymore. So just the passage of time alone, we would expect to see stress levels and those kinds of things decline. And that's one of the reasons we did the 25 survey. But what we found in the, and I'll let Dawn speak more on this, but what we basically found is that the organizations that participated in the programs saw their stress levels, anxiety, and all those other factors or symptomology. We saw that decline to a greater extent than it did just in the passage of time, which was really important. It also, if I remember right, and Don can correct me on this if I'm misstating, but it didn't seem to matter what they did. What was more important is that they were the organizations that participated, and they all saw, we did see some differences in levels, but they may overall decline much more than just the statewide rate for the passage of time.
Yeah, thank you. Yeah, Don, I want to talk about that because that when we talk about what this data talks about and how that drives measurable change, I think it's important to note that it isn't one of those projects. Not one, you couldn't go through that portfolio and say, in this particular project, if you
Right.
apply it to your organization, I can guarantee that your nurses will be less stressed. That's not what the data shows. Can you talk a little bit about more about what is going to drive the measurable change?
Yeah, the important thing to know is that when we set out to do this for all the projects, we had our own level of measure of success. And so our goal through these project pilots was to impact their stress levels positively. Stress, anxiety, and overwhelm were the three factors we were looking at by at least 10%. We wanted an improvement of 10%. And in some cases, we more than doubled that. We met that measure for all three of those and in all of the projects as an aggregate. And that's really speaking more to the method than the actual thing that was being done. Every one of those projects, like any grants, you set your own measurable goals as part of your submission. So they would have had very different measurable outcomes themselves. And some of them met theirs, some of them didn't. Some of them had partial measures met and some partial measures not met. So what we did is we surveyed the whole group, every participant that was available to us, that it was a volunteer response rate. So everyone that was available submitted then to us their experience for the grant and their own stress indicators. And so that's how we came up with those measures. And it really just goes to show that even though a project may have not met their individual metric for their outcome, they still had an improvement of stress. They still had an improvement of anxiety and of overwhelm. And that just means that the method of being able to engage with your workforce, to talk to them, to co-identify and co-create solutions is really the most meaningful thing that we've experienced through this last 4-year project period.
Very, yeah. So I guess that's the next question, and I think probably, and by the way, for all of those who might have come, who joined us a little bit late, we are going to have a Q&A, and if you've got some questions you want to make sure that you get in the you don't want to forget, feel free to go ahead and put them in the chat. We're going to address that later. We'll have like raise your hand kind of conversation in a minute too. We've got lots of time to be able to talk about this, but I think that, you know, the question that everybody's asking is, well, what do I do in my own organization? I want to make my own organization more healthy from a well-being perspective. Not only do I want well-being for the people that work for me, I also want well-being for myself. So if you are an organization, this is for Dawn, if you're an organization, what's the diagnostic that you need to do? What's the diagnostic question that you need to ask yourself in order to get started and implement some of these changes?
I can tell you my recommendation is exactly where we started from these pilot projects to begin with as part of the RFP. You simply ask your staff and yourself, is there one stressor today that I can eliminate? What would it be? And start there. Identify those stressors. Really start with that energy of curiosity. What is one thing that can change today that would eliminate a little bit of stress? It's not change all your stressors. There are stressors abound. That's the beauty of kind of this model, is that it doesn't really matter the quantity you do so much as it identifying, co-creating, and engaging individually the people you intend to impact. And even in the NAM webinar, there was a webinar a few days ago from National Academy of Medicine, and it ended with, if you want to engage with your staff or get engagement from your staff, you have to engage with your staff. So ask the people you intend to impact what it is that you can help them with. It's not promising rainbows and sunshine. It's what is one thing? I can't change this over here. I can't hire enough people today. We're really trying to solve that. What's one thing I can change for you today that might make a difference? And that does a few things. It changes the onus. And Rick mentioned that earlier on. It's not, how can I help you? It's, I recognize there's something in this work environment that's stressing you out. Help me figure that out, and let's try to do something about it, right? It's no longer the person or you as the leader, it's the environment. And there are things that can be changed. There are things that cannot be changed. So you focus on the things that are going to make the most meaningful impact with the ability and the authority that you have to make that impact, right? What you don't want to do is ask the question and do nothing about it. This isn't a survey. You cannot survey this. There's survey fatigue abound. You really have to have that intention, that meaningful conversation, and that co-creation for this to work. And it's evidenced by both surveys, both 2022 and the one that we did this year in 2025. Meaningful recognition and leadership support are still very high indicators represented in both of those populations' responses. And just by coming to a person and asking the question, you're solving both of those things. You're showing support and you're having a meaningful engagement. You're recognizing that the person you're trying to help is the person that's going to let you know how they need help.
Exactly. So what I'm hearing is you want to ask your staff. You don't want to ask them too much, not too often, and you need to be really receptive to what they say. But one of the other things that we learned is that you're going to need to adapt. You're going to need to be able to adapt to whatever happens, because you might hear what they say and you might not ask them too often, and you might be very, very receptive to what they say. But then when you actually implement it, you realize that they weren't really clear in themselves what they needed, but just by asking the question and being receptive, you're going to start feeling that, you're going to start realizing how you need to pivot. Dawn, without going into too many details, can you describe some of the projects? Like, what they started out doing and how they had to pivot in the middle of their project in order to continue to meet the outcome.
Yeah, thank you, Jenna, because that is one thing I didn't mention is that the responsiveness is iterative, right? Like it's not you identify and you do and then you're done. You continually have to have that feedback loop and listen and in most cases pivot. And I can tell you that the projects that did that fared much better, substantially better than those that kept rigidly to the idea that they had at the outset and didn't respond to staff needs as the 2 years went on. So for instance, there was new technology that was brought to the workforce that hadn't been used before. They were a paper-based setting previously. They went into the digital-based setting, which is a lot of change. And when they had created that outset, they had not considered the staff readiness to be able to move into a digital space. And what they found was that it was an added stressor. Change in itself does add stress. So they were trying to identify what that was and limit that change reaction stress. But they also learned through that process that they had to have additional trainings to get staff at a baseline that were able to be receiving the new information. So they didn't know that. And they only experienced that by listening to the staff and their concerns and then addressing it. When they did that, the response rate just improved for them. They had more engagement. They had more not cross-sector engagement, but interdepartmental engagement, right? So they had their technology teams actually talking with their direct line staff. That had never occurred before. So collaboration increased. Just a whole cascade of events can happen just from listening and engaging. And again, co-creating, not trying to do something that you're implementing to people, but implementing it with them. That's just one example. Another one, the organization had originally thought they were just going to do self-care practices. They were going to offer gym memberships and some goodwill things during the workday to make it nice to be at work. And they found that their staff were not receptive to that whatsoever, including their break space. They were going to increase their break space. And when they stopped to intervene and actually ask the questions, they realized that the distance between the break location and the staffing available for their nurses to be able to take a break to go to that said location was too great. They were too far away from where they were needed most when they didn't have staff reliability to be able to do their jobs. So it gave them more stress trying to step away than it did actually stepping away. And so when they stop and listen to that, they were able to redesign the workspace to allow break space options closer and understand that it wasn't exactly that the staff culture was to not take a break. The staff culture was that they're overwhelmed. They can't step away because stepping away means more work for them. And those were just huge underlying causes of things that you make easy assumptions out of. But working with your staff, you can start to identify them and make meaningful changes. And just, I mean, Rick and I went to one organization and just having a conversation, we were thanked profusely with tears. It was kind of an awestruck moment for me, the fact that the simple conversation just doesn't happen often enough. And that in itself can reduce stress.
Yep.
There was one example that I think that for a lot of leaders, especially nurse leaders, you get pressure from everyone, right? You're getting pressure from above, you're getting pressure from your team, you're getting pressure from everyone. One of the things that we talked about is the motivation, like why are you really doing this? Because I think we had one example where they went in with the intention of improving well-being for their group, but there was also kind of an underlying, like, we're going to do two things for one. We're going to be able to do this other thing that our administration would really like us to do while we are improving the well-being. But then they got so rigid trying to meet this goal that they actually didn't meet that one, right? So I think that, Dawn, can you speak a little bit more about like the intention when you're going into these projects?
Yeah, intention, I think Jenna is probably tired of me saying it. It's been my mantra for the year, really, is we have to start with the intention.
You learned it from somewhere, so yeah.
Yeah, you have to start with intention. So if your intention is to really lower the stress, then it shouldn't matter what you're doing. It should matter that the result is always going towards that. So if you're so focused on measuring it and creating a publication or doing something else, creating a case study, whatever it may be, then your intention isn't really well-being. Your intention is to create something that you can show for someone else. So really identify your why. Why are you doing it? And if your why is that you're doing a case study, then be completely transparent about that and don't use it as a cause to say that you're doing something better for someone else. So transparency is a key indicator for trust. And from a leadership perspective, I would suggest that you come with these conversations with a bit of humility. Often leaders, we hold that we have to have all the answers and we have to have all the knowledge and we have to do all the things. And in reality, in this space, when we're talking about occupational well-being, it is very individualized, unit by unit, person by person, organization by organization. And so absolve yourself from that need to have all the answers and open yourself to that curiosity to have the intention, if it is in fact to improve well-being of your workforce, to actually work with your workforce and identifying the stressors.
Very good. Thank you. So to sum up, if you want to improve your well-being, go in with the right intention, ask the staff not too often, be receptive to what they say, and pivot when you need to. 5-step process. I'll make it into a BuzzFeed quiz. Anyway, okay, so now the funding is over, the projects are over. We've gotten all this work done. What's next? What are we doing next? I'm going to start with Rick on this one. Just give Dawn a little bit of a break for her voice. What research are we doing now? Now that we've gotten to this point where we've got this pre-survey, this post-survey, we've got all this information from these pilot projects, the things that we've learned, what kind of research or publications should people be watching for?
We have lots of data from the surveys that we haven't fully analyzed yet because we were trying to get a program up and running. And so that took precedent over doing the analysis. So what we're going to be doing in the next 6 to 9 months is actually taking a really deep dig into these surveys. We have lots of data. We had 5,000, almost 5,500 people respond to our 22 survey. We had about 2,400 people respond to our 25 survey. So we've got lots of information representing all the different practice groups. We have different levels of experience. We have all kinds of stuff to look at to try to understand, are there populations, are there practice settings that are more vulnerable than others? Are there different stages of a nurse's career in which your vulnerability is exacerbated versus others? We do know that from data, national data, we're seeing 30% of nurses quit their first job within the first year. Within year 2, another 20% leave. So we're losing a lot of people early in the career. Whether we're losing nursing or not, we're not really sure because the data don't address that particular issue. But we know that there's a big the turnover is very high, and with nursing schools being limited in terms of clinical placements and seats, if we're letting a third walk out after all that, we need to be that is not a very good utilization of the resources we're having for nursing school. So that's what the first thing we're going to be doing is taking a really deep dive. And then Dawn and I will start, and Janet, of course, we'll be talking about where we go next. But we really got to take a look at the data. We have a ton of it. We just haven't had a chance to look at it. And so in early 26 is we're going to spend some time really taking a deep dive into the data.
Thank you. Dawn, can you share about, from just communicating the results and what we have learned so far, what can people expect to see and what can they see now? Like what tools are available right now if they want to, so they don't have to sit and wait for us to do all of this deep analysis. What's coming and what can they get now?
Yeah, the grant period may be over, but we're just starting the dissemination phase. So we're really starting to let the audiences know, population in Oregon and other know what the result was of these pilot projects. So we'll be releasing next week a just an observed paper of the 18 different projects that we did, and I'll have a quick snapshot of each one of them. So if you're curious to know who did what and what worked, what didn't, what lessons learned, that's coming very soon next week. On our website, we have all of this information as far as the 4 domains and what organizations can do and how to what's included in those, where you might start to have those conversations. Also, the manageable stressors was something that we released this year as far as that information, and really we're talking to phenomena within the work environments of caregivers that can happen or happen most often that we've decided to focus on, and that is moral and ethical misalignment, compassion fatigue, vicarious trauma, and secondary traumatic stress. So we have a lot of information on those phenomena and what you can do from a leadership and organizational standpoint, as well as individualized resources that we released that this year in April. So do go to the link that I put in the chat earlier on in the webinar that can direct you to those resources. There are principles there, there's explanations there. We are hoping to expand these resources. So if there is something that you would find very valuable, reach out to me or to Jana or CN in general. Let us know, because we are very open to helping this work get out and making it a real meaningful improvement through our state in the occupational harms and workplace well-being.
Very good. Thank you. All right, I'm going into the chat, and there's a couple of questions in the chat already. Tom asked in the chat, how do you think about the underlying prevalence of mental disorders? 1 in 5 have a diagnosis in the last 12 months. Some people we are talking about have underlying stuff exposed because of the workplace. Would that pop up in some way? Did you take that into consideration about some of the underlying causes of underlying mental illness that an individual might have, and how that might show up into the workplace?
I'll address it as far as it is a factor that increases risk, right? So it increases susceptibility. So if there are predetermined stressors coming into the workplaces, prior traumas, whatever it may be, mental health disorders, it increases the risk of harm for susceptibility to burnout, susceptibility to the 4 other phenomena in the manageable stressors. And all of that can just exacerbate disorders. And yes, there is an individualized component there of the individual needing to take care of themselves and finding the right resources and support. But also from a workplace perspective, if that is your human resource and you know that this is people work, right? And you need people to do the people work, the very human-centric work, what's within your capacity to be able to help support? And this is a very difficult conversation for a lot of leaders, right? Because you are like, why is it my responsibility to help them through their personal struggles? And that's not what we're advocating at all here. We are advocating, though, that you treat humans as humans, because you need them to do the very human work within the environments of healthcare. And we have worked very hard on those resources on our website, particularly in the manageable stressors, to help kind of mitigate some of those factors from an organizational standpoint on how do you support people. And it really just comes with transparency, knowledge, and continued support. So I don't know, Tom, if I'm answering your question correctly, or if we understood your question differently, but I hope that helps.
Well, I just think it's an important, I mean, it's hard to think about the fact that, well, there's 30 plus people on this call. Well, 3 of the people on this call have an alcohol substance abuse problem. 3 of the people are taking antidepressants. There's probably 1 person taking lithium. So I mean, this is who we are as human beings. And so some of the stuff we're talking about, the workplace can expose it, although it may have been exposed anyway. And because it's underlying, as a leader, you have to be aware that this is in your workplace. If you got 100 people working for you, there's 10 of them that got a substance abuse problem. And as a culture, we don't like to think about the huge prevalence of mental disorders. 1 in 5 people in the 12-month period. That's huge. And so it really falls on leaders to understand the underlying stuff and what you described, which I would call the overlying stuff. And those are related but different phenomena.
It's a really good point. You're never going to have a workforce where there isn't somebody who's dealing with some kind of a mental thing, because if you're going to have a workforce of human beings, they're going to have human issues.
And it was a struggle to talk to my leadership staff to say, you know, this one person, you'll get them into treatment, great, but know that the underlying epidemiology is always 10%. You know, you can't find the 10 and fix them and think that your 100 people are going to be free of that stuff, because the phenomena is it's bigger than us.
It's not math. It's a little bit of an art too. Thank you, Tom. If you have a question, you're welcome to go down into the reaction and you can raise your hand. You can also go down, you can also add something, a question into the chat if you'd like to. Totally open to just have spend the next few minutes just having the Q&A. Christy put a question in the chat. What, if any, projects were put into place for the manageable stressors? We talked a lot about the removable stressors before we talked about manageable stressors. Don, can you share, did we have share the projects that we had that touched on some of those manageable stressors?
Yeah, we did have a few. There were some that attempted to address compassion fatigue. There were some that attempted to also address traumas, not necessarily giving it the language at the time, because remember, we didn't release the manageable stressors until this year, and we started this project in 2022. I will say that because there wasn't the proper naming and education and information that we had available today back then, that the projects that were attempting to do it were a bit of a disadvantage, because we've recognized, and I've said it already, that education and transparency and continued support from a systemic level when you're talking about manageable stressors really is the key factor in being able to mitigate the harm. You can't remove them. Moral and ethical misalignment, by the way, is a term that we've created to consider the entire spectrum of harm that can occur. So you may be more familiar with terms of moral injury, moral rage, moral distress. Those are all encapsulated within the moral and ethical misalignment. And in what other environment is it more abound than in healthcare? I mean, we have current resource restrictions that are from a systems level and from a state level and then from a national level. And there are going to be things that are going to always go against what practitioners know to be doing well within their scope of work and their education, and that they're going to be limited and doing on a day-to-day basis. So that being able to talk to that and express that and have an open conversation about that and all the other phenomena are really what's important. And I wouldn't say that our projects had that available knowledge then. So what we did see was attempts to do a lot of the self-care stuff and resilience building that we've seen for the last 4 years, which is there was the EFT tapping, and there was peer support groups and circles to talk about that mental distress. There was a QMHP that was put into an organization where they allowed that mental health practitioner to be available to their staff. And in that setting, it was profoundly impactful, but also very limited, because they found they were immediately overwhelmed by the demand. So if you're looking to do that, please consider how much you can do with what resources you have. And it was very successful. The staff was responding to that incredibly well, and it was a need that was identified and addressed, but also not available to everybody. So how can you take that and scale it and make it available without limiting that resource? So those were a few things that did happen in the pilots, but we're hoping through the new knowledge and information available on our website that more organizations will engage with that work and do meaningful change.
Personally, I'm extremely excited when we talk about something where we started it at this point and we didn't have the language, and now we do, and it's only been about a 3 or 4 year period of time, right? It's moving very, very quickly, and which is exciting and overwhelming at times, but it's very exciting. Christy also said that it's exciting, and thank you for that. George Gilchrist put in the chat, supported staffer were happy, satisfied, and productive. That should be reason enough for a profit employer to be supportive. Very true. And Christy says, and based upon our conversation from the huddle this morning, are we looking at the systems outside of the hospital, like ambulatory care or long-term care? These are all things that we need to be taking a look at.
Yeah, Christy, to answer that last question or comment that you put in there, we had 18 projects total. 7 of them were now outside of community-based care settings. So 11 of them were actually long-term care and community-based settings that were not necessarily acute care. I know a lot of this conversation can sound acute care centric. It's not. It's applicable to all practice settings, even outside of healthcare in some cases. So yeah, the work is transferable by all means to all practice settings.
I think that that's kind of where I want to end it, if it's okay. Like, we think about all of the things that are happening in healthcare right now. You have big systems that are laying off employees, and it's not because they don't have it's not because they don't have the need and the demand for it. It's just they don't have the funding for it. So you have a lot of stress that's happening within these systems because of layoffs that are happening. Some employers, they got more staff than they could possibly know what to do with. But oh yes, and we are working on a book. That is absolutely true. We have so much information. Dawn, can you talk about that for like 60 seconds?
Yeah, I don't know how I forgot it, but this is a lot of information, right? How do you do it? Where does it come from? What are these domains? And so we've created the website as a resource, but we also wanted to create a guide for leaders to be able to implement this work in their organizations. And so that is nearly finished as far as the manuscript goes. We're super excited to be able to release that soon in 2026, and do look for that. Keep in touch with us.
Yeah, great, thank you. Abigail Hall was a wellness officer identified in any organizations, and was this position helpful? I'm not certain that that was necessarily part of any of the projects that we worked on.
No, and Abigail, it's a very good definition challenge here. So wellness officer versus occupational well-being are very different things. And we're talking about occupational well-being, not wellness programs, which often are benefits.
Mm-hmm. Yeah, that was one thing that we have run into in this work, where we have approached organizations and said, like, how can we work with you to do some kind of this occupational and systemic well-being changes? And their first reaction is, we already have that because we have a wellness program, but that's not what we're talking about. We're talking about an overall systemic change. So yes, that is where I'm going to leave it, because we are running up against our time. If anybody else has any other questions, please go ahead and leave them in the chat. And also, Dawn and Rick, if you wouldn't mind, put your email also into the chat. So if there's anybody on this call, you have any questions, you are more than welcome to reach out to our team, reach out to any one of us. We're happy to discuss these our findings with you, and the things that we're learning. We're not going to stop doing this. This is work that we are very committed to. I mean, we're going to be trying to put together a book because we've got so much information. So feel free to reach out to us. And if there's anything about what we've said here that's really kind of like it's sparking something in you, we are open to being able to come and speak to your teams, to your leaders, to your administration, any of your associations. We'd love to be able to share all of this work that we have had. Please know that there's nothing about what we've said today that is saying that this is a one or the other situation, where it is all, it is where we're saying like, no, it's not the individual. They don't need to take care of themselves. The organization needs to take care of them. No, this is a joint project. This is a joint thing. There are people at an individual level who absolutely need that self-care and that individual care, and they need the resources for it. But it makes no sense to provide all of those resources for them just to have them come back into an environment that's going to injure them all over again. So while we support our nurses on their own journey of healing and from the mental illness or just overall overwhelm and stress, while that is going on, we also need to start healing our organizations so they can be creating those environments where healthcare workers and human beings want to go work. And with that, I'm going to put it all to bed and say thank you so much for everybody coming. Thank you. I'm so excited to be able to share this hard work that we've been doing for a really long time. Please stay connected to us. check out our website, all of the resources that we have, look for our book. And thank you, Dawn and Rick. Thank you for being so tireless over the years in putting all of this work together. It's really powerful, and I appreciate everything. Oh, and Wendy says that this work nurtures her heart and soul. Mine too, mine too. And so I'm really glad that we can share this with you. Please stay in touch with us. We're looking forward to working with you, and there is more to come. Take care,
Thank you,
everybody.
guys.
Have a great Friday. Take care. Bye.